So welcome everyone, good morning. Thank you so much for your time today. We really appreciate you getting on this call. This is being recorded. So if there's anything you feel like you want to, we went over it too quickly or something that you thought of, afterwards, this will be made available to you. And if you wanted to share it with colleagues or as you're filling out the application, feel free to look at the recording. So my name is Christine Gallery. I'm the Senior Vice President for Planning and Chief Strategy Officer at Emerson Hospital. Part of my role is to oversee our community benefits program. And I am fortunate enough to work with Kelsey Magnuson, who is our community benefits manager, and who's been at Emerson for 3 years now and has really elevated our program to new and better levels. So I work closely with Kelsey. Jennifer Lee is with a vendor partner of ours called Health Resources in Action. HRIA has assisted us most recently in our community health needs assessment. And they are also working with us as we send out the RFPs for this DON funding, and will be assisting us in this process. So most of this presentation is going to be done by Jen, but I'll just sort of give you a little bit of context and background about Emerson. So on the next slide, I think most of you know who we are, but just in case. Part of our mission, a very important part of our mission, is to make high quality healthcare more accessible to those who live and work in our community. And we're very community focused and really talk about in our vision and our mission, kind of meeting people where they're at on their healthcare journey. So we really actually don't even like to use the word hospital. We like to think of ourselves as kind of a whole health kind of enterprise. So we care about people before they ever reach us and after they leave us. So it's not about what happens in the four walls of the hospital. It doesn't necessarily mean we only care about you if you're an inpatient or getting a diagnostic test or getting a treatment or a surgery, that we really care about the community and their health status, whether or not they get care from us. We are a regional, we consider ourselves a regional medical center, sort of broader than a community health hospital. We provide services to 25 towns and over 300,000 people. So as I mentioned, we have most recently done a community health needs assessment. This is a tri-annual evaluation that we do. And this is also required of us by our Massachusetts Attorney General. And it's really important to gather data to really try to understand what is the current health status of the communities we serve, where are the gaps, what issues need to be addressed. And to do this community health needs assessment, which we've been doing since January, the process started in January and it's just concluded now, included both quantitative and qualitative research. So doing looking at secondary data, things like mortality rates, birth rates, things like that. But also we've administered a survey. We had about 3,500 responses. So this is residents and providers in our service area. So really rich data that we've got from that health survey, and also quite a number of interviews and focus groups with community residents, leaders, providers, different organizations. And really the goal of that is to, as I said, better understand issues that our residents face, how are they currently being addressed, where might there be gaps or issues, and most importantly, where are there opportunities to address these issues. So next, I'm going to turn it over to Jen to kind of take it from here to sort of connect what we found in our community health needs assessment to where we're going to focus on in our DON funding.
Thank you so much, Christine, and good morning to everyone. It's truly a pleasure to be here with all of you to talk about this really important funding opportunity that Emerson Hospital is making available. The next section of our agenda will be walking through some of the key components of this funding opportunity. And afterwards, as Christine and Kelsey mentioned, we'll have ample time for questions. So you don't have to wait. You could feel free to add your questions in the chat box as we go along, as I talk through some of this content. And perhaps I might even cover some of the questions that you might have as we go along. So feeding off of the community health and needs assessment that was conducted earlier this year, as Christine just highlighted in the prior slide, the focus of mental health really emerged as a clear and significant health priority that was identified within that process and around which this funding opportunity is really focused. The assessment identified that mental health in particular affected residents across the service areas that Emerson Hospital really focuses on, regardless of an individual's age, income level, and race and ethnicity. And specifically, a number of issues were really elevated or raised in the assessment process that was conducted. They're listed here and I'll walk through them. One is that high costs associated with mental health care that is certainly exacerbated if you don't have access to health insurance coverage, but even if you have coverage, cost still remains a challenge. The second area that really emerged was the complexities of the mental health system, making it hard to know where to go, whom to contact, how to essentially get help. And so that difficulty in navigating the mental health system was a really prominent issue that was raised. Thirdly, stigma, how individuals may be made to feel if they have mental health challenges, and that really can hinder their ability to obtain help and support. And then the last three bullets really comprise and sort of cover the help and resources that are available for individuals who are struggling with mental health challenges, really in appreciating and recognizing that there are more people who need help than there are providers. And that leads to long wait lists. It's most prominent among adolescents that we see within the field, or individuals who do not have access to health insurance coverage. Finally, providers may not be equipped to support the specific mental health needs of different populations, such as individuals who are domestic violence survivors, people of color, and residents who identify as LGBTQIA. And so just some really prominent issues that have been elevated through the assessment for residents in Emerson's service area. This next slide really also highlights other related issues specific to our youngest population in the service area. The assessment really identified that many youth experience high anxiety, experiencing academic pressure within the school systems, and that has certainly been compounded and challenging this past year in the pandemic. There have been challenges around online learning, as we have heard, and limited space at home. And that relates to social isolation that many youth have experienced, and economic insecurity among families as well. That is a growing challenge for many residents in the area. So what brings Emerson Hospital to this point and to offer this really valuable funding opportunity is a statewide process known as the determination of need. This process specific to Emerson was catalyzed by a new ambulatory surgery center that has been developed in Concord and will provide some important and routine endoscopy procedures. We've listed here a website that drives you to the Massachusetts Department of Public Health that governs the overall statewide determination of need initiatives, where you can find out more information. But the broadest picture is that institutions that are developing such new centers are committed to dedicating and contributing a proportion of the costs associated with that new center to supporting community health initiatives. And that is what has spurred this process and furthers Emerson Hospital's continued investment in the community. Importantly, for determination of need initiatives, Emerson Hospital is really looking to support efforts that address social determinants of health, and we'll talk about that a bit more in the coming slides. So on this slide and the next few, we're going to detail some specifics about this funding opportunity. All told, Emerson Hospital has a total of $190,000 available for this particular determination of need request for proposals. And the hospital and institution is looking to support efforts that are multi-year in nature, anywhere up to 3 years, and at a range or dollar value of $25,000 to $65,000 per year. Very specifically, Emerson is looking to support activities and initiatives that demonstrate impact on improving access and availability to mental health services. Now, there are two types of approaches that Emerson Hospital is looking to support, and those are detailed here. The first is known as community clinical linkages, and community clinical linkages are defined as those efforts that can really strengthen or build connections between community organizations, so nonprofits, community-based organizations as they may be known, along with clinical sectors for the overall purpose of improving population health. And in this case, it would be really strategically and specifically trying to improve the mental health of residents in the area. The second type of approach that Emerson Hospital is looking to support is known as policy systems and environmental change approaches, or it's oftentimes shortened to PSE change approaches in the field. And PSE change approaches are defined as those that really support long-term change within communities that enable residents to make healthy choices, not only practical, but available to all who reside in their society and in their communities. We really link, and in the public health field, PSE change is really identified as key to addressing the inequities that exist in our society, those that are really unfair and unjust. And on this slide, we draw from a source known as Human Impact Partners to define health equity here, which you can see is really the state in which everyone has a fair and just opportunity to be as healthy as possible. To achieve this, organizations and partners must really acknowledge the ability to remove obstacles to health, those such as poverty, discrimination, and deep power imbalances, as well as their consequences, which may include things like lack of access to good jobs with fair pay, quality education and housing, safe environments, and healthcare. And so as you consider different approaches for this funding opportunity, particularly if you were in that second bucket of PSE change, we encourage you to adapt this definition and to use it to not only identify, but to address some of the root causes of inequities that may exist for mental health access for your particular population. One other really key component of this determination of need funding opportunity is the role that community engagement may play. And that is really defined as how members of your community who are directly affected by mental health may be involved at any stage of the work that you have planned if you were to be funded by Emerson. And that could include in the design, so as you're planning out a certain approach or initiative and looking to get it ramped up, to implementation when you're actually doing the work, and or finally in the evaluation. So as you're looking to try and measure the overall impact of this work at any or all of these stages, Emerson Hospital is interested in hearing how you may engage members of your community who are affected by mental health. In terms of eligible organizations, Emerson seeks to support community-based organizations, nonprofits, and municipality agencies with a 501c3 status, and specifically those organizations that serve residents in one or more of any of the following towns within the service area. And specific for this determination of need funding opportunity, those towns are listed here, 22 in total that I'll walk through the list for. These include Acton, Ayr, Bedford, Berlin, Bolton, Boxborough, Carlisle, Concord, Groton, Harvard, Hudson, Lexington, Lincoln, Littleton, Maynard, Pepperell, Shirley, Stowe, Sudbury, Townsend, and Wayland and Westford. There are also a number of different organizations or entities that are not eligible for this funding opportunity, and those are listed here. They include any provider that currently operates under Emerson Hospital's overall license as an institution, as well as any associated Emerson practices or satellites. The Emerson Hospital will also not fund any individual person that's trying to apply for this funding or any for-profit entities. And finally, capital improvements are ineligible. Those are really defined as any addition or alteration to a property. So if you're looking to build up a portion of a building or a building or anything in that domain, that is unfortunately not eligible for this funding opportunity. There are a set, however, of expenses that are allowable. And as part of your application, there has been a project budget template that has been developed that includes all of these categories. And that project budget template will allow you to indicate of the total funding you are looking to apply for, how you would allocate those dollars to any number of these categories that you see listed here on this slide. Many organizations may be looking for money to support staff, so aka personnel costs, and you can include in that tax and fringe benefits. Subcontractor subcontractor expenses may be helpful if you identify that within your own organization, you may not have the expertise or the know-how to carry out a certain activity or even the capacity. So you may subcontract some of your money out to a different entity to accomplish that goal. Stipends for community members are really valuable, especially as we link back to that slide that I covered around community engagement. So how to acknowledge their role in this work and to support their efforts with stipends or other supports could be valuable. And then a range of different operating expenses that are listed here. Those may include office supplies, equipment, copying and printing, telephone and fax, postage and delivery, postage advertising, staff travel, training and educational supplies, staff training and evaluation. Partnerships we want to underscore are incredibly important, in this work, and they're seen as a way to really leverage the dollars and the resources that you may receive through such a grant to really addressing mental health using upstream approaches. And so we encourage you to think about what other partners you may want to bring to the table, if you will, to come at this work and to collectively accomplish your goals. And we encourage that if you formally identify partners that you want to go in on this grant with, what is typical is that a lead organization or a lead applicant would be the entity that's sort of listed formally on the grant application and can then work out a process that if you were to receive a grant that you would allocate those dollars accordingly. But overall, we welcome knowing if there are other entities or organizations that you plan to partner with to achieve your overall goals. Now, the next two slides cover 7 critical criteria that the Emerson Hospital team has identified with its community partners as really being elevated in this process, and that in reviewing applications, we will be prioritizing. So in this first slide, I'll cover 3 of them, and then on the next slide, the remaining 4. Emerson Hospital is really interested in whether your particular approach will ultimately address inequities. And when you are presenting your initiative, whether it truly addresses mental health among a population or community that experiences inequities in the service area. So supporting information that you can provide, really addressing that would be really helpful. Secondly, whether this is actually a PSC change or again, policy systems and environmental change approach that seeks to address in an upstream manner the causes of mental health outcomes and the challenges that people have expressed experiencing trying to address mental health challenges today. Relatedly, that your approach will ultimately have an impact on mental health, whether it addresses some of the limitations that you saw listed on some of those earlier slides or others that your community may identify, and overall that it reaches that goal of improving access and availability of services, and also that you may be able to demonstrate that through evaluation, what your ultimate impact has been. This slide shows the remaining 4 criteria that will be prioritized. Community engagement, as we talked about on an earlier slide, again, whether individuals who are directly affected by mental health are engaged in any stage of the process. Partnerships, as we've also already highlighted, and specifically in your application, what we would welcome if you include partners is what are their clear roles and responsibilities in the overall effort, and how does that enhance your overall approach? How does it complement or supplement what your organization may be doing? Feasibility is really looking at, well, how likely is this initiative to succeed in what it is set out to do? We'd welcome and encourage you to think about including aspects like your past experience doing this work, your existing capacity to do this as an organization, and any identified partners that will help you accomplish your goal. And then finally, sustainability looks at what is the likelihood that after the life of a grant cycle, as many do conclude at some point, and in this case, it's anywhere up to 3 years, what is the likelihood of showing impact beyond that particular time frame? Now, to get at the nuts and bolts of if your organization is interested in applying, the next 2 slides outline for you the key questions that we're interested in gathering information from you on. And so we welcome if you can respond to each of these next 8 questions that will cover the next 2 slides in a Word document that is no more than 5 pages in length. So our first question is really looking to understand what your organization's mission, who are some of the key staff members who will be doing this work, and what's your overall experience related to the type of work that you are proposing in your grant application? Have you done this before? What have you learned, or what experience do you really bring to the table? The second question is around your population of focus for this funding request. Who are you looking to serve, to assist, and to really focus your efforts into supporting when it comes to addressing mental health services? And we'd welcome, related to that, any demographic information that you have. This can include, but is not limited to, ages, gender, race and ethnicity, and socioeconomic status, as well as if you can share with us a general anticipated number of people who might be impacted by the sort of totality of this work. Third is, what are the mental health needs of your population, and share with us the barriers that exist for your population when it comes to trying to access mental health services, and what are the inequities that really exist for your population, again, drawing back to the definition that we shared on an earlier slide around health equity, and therefore what are the inequities that exist for your particular population. And then when we think about geography in Emerson Hospital's broader service areas, which one or more of the towns and communities will be impacted, and are communities where your population or populations of focus really reside. The remaining questions are the following. Number 5 is really sort of like the meat of this work. We're looking for you to share with us what your goals, activities, and timeframes for each of the years, again, anywhere up to 3 years, that you are requesting funding for. So really, what are you looking to do with the funding if you were to receive the grant? What are you seeking to accomplish, and by when? And if you have any supporting information or evidence that this approach has an impact based off of past experience or what may be known in the field, we'd welcome that information in this application. The 6th question gets at partners. So as we talked about, if you have specific partner organizations that you plan to engage in this work, who are they, and what will their specific roles and responsibilities be? And how does that complement the work and the expertise and the knowledge that your specific organization brings to the table? 7 is around community engagement. How do you directly engage community members affected by mental health in any stage of this work? And then finally, evaluation. So if your organization has any strategies or tools around evaluation that you've used before or you plan to use to measure outcomes and impact, we'd really welcome that information in this proposal. There are also a few other required attachments to make up the rest of your application. So as I mentioned before, on the webpage dedicated to this funding opportunity, there is a project budget template in Excel format that we have shared with you, and that hopefully makes it easy for you to share with us how you would spend your funding if you were awarded a grant. And we ask for you to fill out that budget form for each of the years that you're requesting funding for. So if you have, for example, a 3-year request that you're putting forward, please fill that budget template out for each of those 3 years so we could see sort of how that funding is spread out over that time. We also ask for an organizational budget from the lead applicant in the case that you're submitting sort of a partnership proposal from your most recent fiscal year, and a verification of 501c3 status, whether that be for the lead applicant if they already have that status, or that of a fiscal agent. And finally, to really help us understand the breadth of some of your partnerships, we'd really welcome up to 3 letters of support. If you have partners that you're officially naming in your proposal, we'd welcome them from those organizations, but we'd also welcome them from other partners that are really familiar with the work that you've done over time in the field. On this slide, here are some key dates and timelines. The RFP was formally released as of earlier this week, and applications are due by the end of the day on October 18th. Emerson Hospital and its partners will take then the next subsequent weeks to review the applications that come in. And by the end of the month of November, we'll announce those awards. The month of December will be taken to sort of process those, so grant checks, grant agreements, and et cetera, and sort of get all of those awardees set up. And that allows for an official and formal kickoff in the start of the new year for year 1, and then subsequent the following 2 years following them. This slide just shows you a sort of window screenshot of the webpage that is the community programs webpage of the overall hospital's website, where all of this information lives, including the formal RFP and any other related templates. So we've listed the website here for you to revisit regularly and to know that that's where all of the overall information is housed. And finally, for any questions that you may have over the next few weeks as you're thinking about whether to submit a proposal or the proposal itself. Kelsey Magnuson, Community Benefits and Events Coordinator, who opened up the presentation along with Christine, is listed here along with her contact information. This would also be the email address that you would send your applications to, again, by October 18th. So I believe that that is formally my slides. I saw a few things pop up in terms of questions. So as I'm reading and processing them and then working on providing a response, what we do is continue to welcome you. If you have questions, please feel free to share that in the chat box so that we can have a running log of them, and then we'll sort of take them in turn overall and provide responses with you. So the first question we have is from Jen Riley. Hello, Jen. And your question is, does this funding have to be used to support a new project, or can it be used to expand existing programming that fulfills this criteria? And Christine and Kelsey, if you want, I'm happy to start to address this if you'd like me to, and then if you wanted to hop on, or if you both wanted to start, whichever you prefer.
You can start and then we'll hop on.
Yeah. And that's a great question. I think Emerson Hospital is welcoming applications on either of those fronts, whether it's a new project or expanding existing programming. I think if your organization is thinking about sort of the latter scenario, which is expanding existing programming, it would welcome information about how the funding can still enhance new aspects of that programming, or what the funding will allow you to do that's sort of different from if you didn't have the funding. So if that makes sense, it doesn't have to be a brand new program that has never been kicked off before. It certainly can be one that you've run, but really, how does this funding enhance your abilities to do that? And Christine and Kelsey, if you want to
Yeah, and I just think, as long as it meets the criteria, it's really important that it be something that's expanding, and it's also meeting, just make sure it meets all those criteria. I think it's fine to do something that's expanding an existing program.
Thank you, Christine. And thanks, Jen, for that question.
Thank you so much.
Oh, of course.
Yep.
The next question is from Griet, and thanks, Griet, for your question, which is, can some of the partners be for-profit organizations, for instance, primary care provider groups? I'm going to take a peek over at Christine just to see. We know the lead applicant does have to conform to being nonprofit 501c3, but in terms of partners, in terms of what Emerson might think about that particular setup.
So I'm hesitant on this one because the exclusion of for-profit is, I think, something that came from the DON office itself, from the state itself. So I would have to get clarification from them. My guess is no, but we can get clarification and let you know for sure. I'm sorry, somebody mentioned primary care practice. So again, the exclusion is it can't be any provider that's operates under our license is currently affiliated with us. So I'm not sure what primary care group you were thinking of, but most of them in our area, all of them in our area are affiliated with us. So that would be excluded.
Thanks.
But we can get clarification on, is it the exclusion of just the lead applicant, or is for-profit excluded for all the partners? I just need to get state clarification on that.
Thank you, Grit. We'll definitely follow up on that. And thank you, Christine. And we have another question from Christina Penna. Is there priority towards organizations or projects that serve more than one of the towns in Emerson's service area? And I think broadly, and Christine, Kelsey, if you'd like me to start on this particular response.
Sure. Yep.
Okay. I think broadly what Emerson is looking to do is to ensure that its funding can serve as much, or as broadly speaking, across its service area as possible. So that may relate to the number of towns, but it also may relate to the number of people as well, too, I think would be another factor, which, as you recall from the application questions, is specifically noted. I think we wouldn't say that there is necessarily like, one town may serve any number of people and two towns may serve either more or even a same amount. So I think what Emerson would welcome is share with us which towns your organization does serve and where residents reside, And that is welcome, coupled with, if you have an anticipated number of how many actual people will be served, I think the coupling of that information would be most helpful. But Emerson has not indicated that, for instance, that if you serve 10 versus 1, that would sort of be a keen advantage. But Christine and Kelsey.
No, that's correct. That's correct. I don't have anything really to add to that. That's correct.
Thank you. Feel free to keep on thinking of questions that you may have and sharing them in the chat box with us. That will really help us keep a log. And thank you, Christina. Glad that helped address your question. We have another one from Jen Riley. Can you provide an example of a project that would fit the criteria and be ideal? And if I'm right, Christine and Kelsey, Emerson Hospital is not seeking to be prescriptive of your particular approach. By virtue of being a community-based organization and nonprofit in the field, you likely are drawn upon a range of experience and expertise in this, as well as knowing specifically when it comes to mental health for your population and the residents in your area who are served, what is really sort of the barriers and limitations to accessing mental health, as well as what possible approaches are. So Emerson will not be prescriptive on sort of, and even say like what specifically would be done.
Right.
Point of this process is to really hear from you all what you were proposed to do with funding. And Christine, Kelsey,
right, yeah, I ditto, exactly. I don't want to be at all prescriptive.
A question from Lauren: are you expecting to have one organization awarded or multiple? And I think that's a great question as well.
It's a good question. Yeah.
Yeah, we've listed the ranges of the sort of dollar amounts that Emerson Hospital has sort of put out there for you to react to, and that might help frame that $25,000 to $65,000 range per year. It will likely depend on sort of what applications we receive and the merit of those proposals that are submitted. Emerson will definitely be taking, the most global look at its resources and how it really wants to allocate. So we don't have like a definitive number. The hospital has been really intentional, though, about ensuring that sufficient resources can be provided to any particular approach, because we know that the amount of dollars that an organization can get is really meaningful to sort of the impact that they can make.
Yeah, and I will be, I'll be transparent about that. I mean, we're not talking about millions of dollars, right? So the state has given us guidance that, they really want the dollars to be have an impact. So they are encouraging us to kind of go with fewer. So it's not going to be dozens, because $190,000 divided by 3 divided by a dozen, they feel that's just not enough dollars to have an impact. So they are encouraging us to really try to limit it and kind of go with the fewer numbers so that we can give a significant enough amount to each organization to really make a difference.
Thank you. A question from Jennifer Beckford. I work with 10 towns, but only 8 of them are towns that Emerson serves. Will we need to exclude the 2 towns that are not served by you from this grant? I would say that Emerson is really interested. One, it's great that you already are connected and serve 8 of the towns of the overall list of 22. So that is really terrific. I think the hospital is most interested in hearing in your application the work that would be centered in those 8 towns that are part of the service area. I think broadly, your organization may serve the other residents in the other 2 towns as well. My understanding, Christy, if I'm right, is that the funding would really look to focus on the work you can do in any of those 22 towns.
Yeah, we really would want to hear what you would be doing in those 8 towns that are in our service area. These are our dollars. This is part of our mission, and our mission is to serve our communities, right? So I don't, I hate the word exclude, but we would really want to hear more how the dollars would be specifically going to those 8 towns in our service area.
I also just want to jump in. I know that someone was asking for examples of projects, and I want to open up my time and a little bit of Christine and potentially Jen's. If you have a project that you're questioning or wondering if this is in line with the application, we don't want to waste anyone's time. These applications take time and effort to fill out, so we don't want you to fill out this whole thing if it's completely off base. So feel free to reach out to us individually if you give a short description, or this is what I'm thinking, or if you have more specific questions about a project. I do want to open up my time to discuss further, as we can't give prescriptive now, but happy to talk about your specific thoughts and projects.
Thank you, Kelsey.
Thanks, Kelsey.
Other questions from folks? We'll give it another few minutes just in case you're pondering sort of any aspects that you're interested in hearing more about. And a great comment from Grit. So welcome back, Kelsey, which ditto for many of us who know Kelsey.
Kelsey's just returned from a maternity leave, and we're thrilled to have her back.
Thank you, everyone.
Any other questions? We'll give it another minute or so. This is certainly not your only time to ask questions as well. As you saw on the last slide, there is Kelsey's email address, communitybenefits@emersonhos.org, where you can send questions as well as your final application. Again, we'll say October 18th is the key date to submit your application if you are interested in this grant. We welcome and really look forward to the review process. You'll hear from Emerson Hospital by the end of November in time for the busy end of year timeframe and holidays. But excitingly, those that are awarded will be able to kick off their activities for the start of the new year. A question from Lauren: how many applications do you expect to receive? That's a great one. And quite honestly, we don't really know. Emerson has been really strategic in kind of spreading this opportunity far and wide through its email blast. It's on that dedicated webpage, which we talked about. Word of mouth will certainly help as well. But I think the overall process is Emerson Hospital has put out its vision for this funding and what it hopes to support. And we hope that that resonates with a number of nonprofit and community-based organizations in the field. Those organizations will have to decide for themselves if there is a match and if they want to apply and for what and so forth. But we are looking forward to whatever number of applications we receive, but we don't have a guesstimate now.
Yeah, we don't. We really don't know.
Yeah. We might have individual predictions, but we don't formally know. And then Christine has a question of, will this be an annual opportunity? And Christine, did you want to address that broadly, or would you like?
Yeah, so this is funding that we have to provide for 3 years. So the awardee or awardees will be given a dollar amount each year for 3 years, starting in January of 2022.
Thank you.
So just to further that answer, this is a one-time application, but over 3 years.
Yeah. And drawing back to that slide where we talked about determination of need, the catalyst for this particular funding pot of money was really spurred by that new endoscopy center. So under state guidelines, when a new building goes up under a hospital or hospital institution's umbrella, that catalyzes this particular pot of money being available. So this is one time in that nature, as Kelsey has highlighted.
And the amount of the funding is tied to, it's a percentage of the cost of the project. So there's a formula. That's where the dollar amount came from.
Okay, thank you for that answer. That was helpful. I was more curious about like the, well, I guess if this is like the amount of funding for those 3 years, I'm guessing it might be too early to tell like if there will be anything after the 3 years, or unless there's like another building or something. But
so right now this is the amount of the funding that's tied to this DON. So this is all we can commit to. Beyond the 3 years the answer is don't know.
Okay,
it really depends on.
Just wanted to clarify. Yeah. Thank you.
Yeah.
And that is in addition to, Christine and Kelsey, if I'm reflecting this correctly, the broad supports that the community program department issues to the community on a regular basis and other forms of grants. This is just a particular sort of track of funding that we're here to talk about today. But the department certainly supports and invests in the communities in a number and myriad of different ways over time. Thank you, Christina, for that question. Any others before we wrap our time here? Great. Well, thank you for being here.
Thank you.
Yeah.
Thank you.
Great questions. And if you have more, please feel free to send them Kelsey's way. And any other wrap up from the Emerson Hospital team to offer?
No, I just want to thank you so much for your time and attention. And again, this is not your only opportunity to ask questions. Feel free to reach out to Kelsey. We'll be as helpful as we possibly can be. And if you decide to apply, good luck.